Hi, everybody. This is the Dr. Debunk weekly podcast show. On this show, I'm going to be debunking the medical myths, garbage, and crap that's spread by doctors and other health professionals. Dr. Debunk is the medical truth teller. Welcome, everybody, to today's podcast on antioxidants and anti-inflammatory. The podcast today is part 2 of the podcast. It's really a short version of a book that I wrote 5 years ago now, called The Antioxidant Inflammation Connection, which is the most important medical finding of our lifetime. So if you haven't listened to part 1, you got to go back and listen to it. So just as a quick reminder, I basically gave you an intro last time about the difference between antioxidants and inflammation control and some of the background. I'll do a little more now. And so antioxidants, as I mentioned before, have been around about 40 years. The concept of increasing our antioxidant level because we're slowly being oxidized or arrested. We're reducing power in our body. We have all these natural antioxidants, and you hear about vitamin C and vitamin E and selenium. And those, unless something's changed in the last few years, they're really not antioxidants in the way we think of them. It's a common nutritional belief that these act as antioxidants, but they only do that in an abnormal fashion. In other words, when we start to run out of oxidation power or our own natural antioxidants, and there are things like superoxide dismutase, which of course everyone here has heard of that. I'm not going to get into the names of the biochemical and metabolic substances our body uses because unless you're a science nerd, it doesn't mean anything. We just have natural antioxidants, but because we're being over-oxidized with age and draining the supply of these things, vitamin C, vitamin E, selenium, they are abnormally sucked into this process of acting as antioxidants to protect us from the damaging effect of free radicals, pollutants, metabolic byproducts, everything you hear of that's bad out there, which actually is probably why with age we start to have nutrient deficiencies. I mean, it's really not that easy to be deficient in vitamins and minerals. Now, that's true for people over 40-ish. Younger generations in America are now eating so badly, I believe we're going to start to see nutrient deficiencies. Well, it's not belief. Vitamin D has become an radically, epidemically deficient vitamin in the U.S. population. I mean, I'm finding women in their 20s, women and men in their 30s. It's a whole big thing. I did a podcast already on vitamin D. You should listen to that. But anyway, so we basically have natural antioxidants, and they're running out. And so resveratrol, which is the main antioxidant, along with anatobine in my book and this discussion, has been studied for 35, 40 years. But what I had said to you before, in the last 7 years, it's been really studied now for its anti-inflammatory controls. And so things like resveratrol or nutrients, they're not essential vitamins or minerals. They probably are essential, but they're more like micronutrients that if you didn't have any over the course of your life, it would cause problems. But essential nutrients are things that kill you within a year. So if you don't have any vitamin D at all in your diet, 12 months later, you'd be dead. If you don't have any vitamin C, which is a water-soluble vitamin, you'll be dead in 4 months from scurvy. So nutrients are things that we know make us more healthy, but there really hasn't been enough work, and in some cases no work, to understand how much. Like how much resveratrol do we naturally need? Now, one example is CoQ10. Enzyme CoQ10 is always talked about being a heart muscle enzyme, which is dopey. CoQ10 is in every cell of your body. It's an energy substrate. It's very important in how we make energy. And there's been a lot of work on CoQ10. There's been enough actually to do specific dosing protocols. It's something I use for energy restoration for people over 55 or 60 when the first line of things that suck energy out of people with age don't work. CoQ10, I put people on a loading dose. They take it for 2 months. There's a whole way to do it. And it's based on real science. And it can be very effective. Anyway, so for resveratrol, talking about it as an anti-inflammatory, there's been enough work now in the last 7 years to very specifically know how much to give, what to do with it. And that's what I'll get into down the road. But the million-dollar question is, now we're going to just talk about inflammation. Why does our body lose control of inflammation? Or more specifically, how does inflammation work? As I mentioned before, we've always thought of inflammation as being bad. And as a reminder, swelling or edema is not metabolic inflammation. Inflammation is a complex set of metabolic and cell molecular reactions that our body uses specifically. We cause inflammation, but we cause acute inflammation. And it's caused by numerous systems. The main molecules are called interleukins or cytokines or chemokines. Sorry, we have 3 names for the same thing. Chemokines, cytokines, and interleukins. They're all a little different. But the most common term is interleukins. And these are little molecules that spin up inflammation. I mean, that's all I'll say for the sake of this podcast. The more interleukins you have, specifically 1 and 6, the more they bind to a certain part of your body, the more it inflames it. And the body uses that as a stress response. So, let me back up. All inflammation is either acute inflammation or chronic. Acute inflammation is a normal response the body does to an increased level of stress to whatever part of your body was stressed. So, if you think hard today because you're studying for a final exam, your brain inflames. It causes an inflammatory reaction. If you walk farther today than you normally do, if you run farther, lift weights, whatever you do, that will cause increased inflammation to that body part. If you have a crazy weekend where you're pounding down carbs like a maniac, that inflames your pancreas and the other hormonal systems involved in processing carbs. So all stress to the human body causes acute internal inflammation. It's a signaling mechanism. It tells the body that part has been used heavily, more than normal. And so now the body knows where to go to fix it, make it stronger, make it better. All infections cause acute inflammation. That's how your body knows you're being attacked by some nasty little bug. And then, as I've already mentioned, when we don't get rid of the daily amounts of inflammation that are caused by the different body part stressors, that leftover inflammation is chronic inflammation. And that's what starts to wreck us. And as I already mentioned, under 40, 45 years old, we seem to get rid of the daily accumulated inflammation. It goes away. And then the response of healing is fully. I guess the simplest way to understand it is acute inflammation tells the body, fix it, make it better, heal it. And then when the signaling is done, which is 25 to 45 hours maybe, all the inflammatory interleukins, all the chemicals wash out, and now you can fully heal. If you don't get rid of the acute inflammatory response, say by 5% to your knees because you were on your knees all day, scrubbing your floor or stripping the floor, that 5% of non-removal of the inflammatory interleukins, that's going to cause a certain degree of scar tissue, and you're not going to heal 100%, you're going to heal at 95%. And that's what really begins in the 40s. And so we keep not fully healing. And each organ system in your body marches through these inflammatory trigger cycles at different rates. So you could be 65 years old with your heart, but you could be 85 years old with your pancreas because you've strained it so much. Probably a better example would be your knees. Your heart is fine. you've been in decent shape your whole life, been kind of athletic, but you wrecked your knees because of your job and other factors. And so your knees could be 85 years old and you need knee replacements, but the rest of your body is 65. And so the whole point is what we can do now is use high-dose antioxidants as anti-inflammatory agents. And as I mentioned, resveratrol and enatabine are the only two that have sufficient science to be able to use them effectively. Now, here's the problem. Since I wrote my book, enatabine's been taken off the market. The trade name of enatabine was Enatablock, and it was made by Star Pharmaceuticals, who was making millions selling this stuff. They were kind of ahead of the curve. They came out with Enatablock a couple years before medicine even realized this. I don't really know the story of how they figured it out. Enatabine probably is the best antioxidant to date because its molecular size. It's a very small molecule. I want to explain why that's important, but it is. Anyway, to make a long story short, for all of you that love conspiracy theories, which would be me too, Star Pharmaceuticals is making millions. They got a letter of warning from the FDA that told them that they had to stop advertising, that Enatablock could reverse inflammation and do these things that it does because that's medical treatment and they can't do that, blah, blah, blah. And you got to understand something. Nobody cares about FDA warning letters because it's just a warning. The FDA has to take you to court. It takes years and years. I mean, people keep on selling their snake oil for years before anybody does anything. Case in point would be Zicam nasal spray. The original spray was a zinc-based spray back in the early 2000s. And they sold a lot of it because zinc is a germicide. And if you sprayed a ton of it in your nose, mouth, and throat, like emptied a bottle in a day, you could really wipe out a cold or flu. But it interferes with the way you smell. And so they fought the FDA for years, a couple years in court before they finally gave up. My point is, Star Pharmaceuticals stopped making it basically the day they got the letter, and they've never been heard from again. They had a multi-million-dollar product that had great science, worked amazingly. I did a study with them on 20 patients over a year, and in 2 months on enatabine, the patients had no aches or pains. It's what got me started in this. I also studied resveratrol 5 years ago with about 40 patients, which is how I got going, and I got pretty much similar results with enatabine and resveratrol. But enatabine's gone. So why did a company stop making this multi-million-dollar product that was safe and natural and great? Well, who knows? But we waited for a couple of years for them to come back, but they're not coming back. So until somebody picks it up, we're stuck with resveratrol, and unfortunately some people can't take it because of its laxative effect, which I'll get to. Okay, enough said on that. So the only thing I can talk about is resveratrol. And so, as I mentioned, resveratrol's been around a long time, over 30 years. And how, just as a little history, cancer doctors apparently discovered this because resveratrol kills cancer cells. I mean, there is numerous studies, laboratory studies on resveratrol, and it kills most cancers it comes in contact with. If you put enough resveratrol in a dish with cancer cells, it'll kill them. And so apparently they were studying this because they thought they could make a drug out of it, but it didn't work out. I don't really have the details why, I'm not sure. But when you study cancer, you study inflammation because cancer causes massive inflammation. Well, as they were doing these studies, they saw the interleukins just plummet. They saw the inflammatory response just disappear with very high dose resveratrol. And that's how they figured out that, wait a second, this stuff acts like a steroid, but it's not a steroid, and it doesn't have the downside effects of steroids. And so the whole thing got going. And so fast forward, now we have 300 laboratory studies, 15 clinical trials. And so I'm not even going to get into trying to prove it. In my book, I mentioned I have like 50 of the abstracts in the back of the book, but you can go on PubMed yourself. You can see all the studies. It's all there. And so that's the background. And so what did I do? Well, 5 years ago, I took about 100 patients over a year and kept track of what happened with them. And so based on the work that had already been done, the laboratory and clinical trials, I had a great starting point. And so I was giving patients 2 to 3 times more resveratrol a day than it had been used, but it was based on studies. And within 2 months, 75% of patients that had aches and pains of aging had 50 to 100% reduction of those aches and pains, including me. I mean, I was always a sport head kid. I mean, from 20 to 50 years old, I played 30 hours, or I played 10 hours a week of racquetball and basketball for 10 years. I mean, for 30 years, pushed my body hard. And so I got a bad knee, I got a bad neck from a motorcycle wreck, and a bad shoulder from 30 years of racquetball. And I was really, before I started this, feeling it. I mean, if I played an hour of racquetball at 50 years old, I couldn't move for a week. I mean, my neck, I'd have headaches. It would kill me. And that's why men, we love to be physical. We just give it up because it hurts so bad. I mean, you have an hour of fun and you pay for 2 weeks for it. Who wants that movie? But since resveratrol, nothing hurts. I can play racquetball, basketball. I mean, I have 9 acres of property and I work like an animal on the weekends. Junior farmer, yuck. But I can do all that stuff. And I don't have the endurance when I was 30, but none of it hurts as long as I follow the resveratrol protocol. And so that first year, I had 100 patients and got those results. Same thing with the Nattabine. It was just that amazing. And so I had never seen in my career, which at that point was about 16, 17 years of using natural stuff. I'd never seen natural things, any natural thing, have such a dramatic and quick effect. I mean, 2 months, 2 to 3 months, it's dramatic. Because natural things usually take a long time. And so from that point, starting, I began to see a lot of things that you could do, like resveratrol will lower blood pressure over time, which makes sense. Part of blood pressure is a problem with your arteries and veins. And so you reduce the inflammation of your arteries and veins, your blood pressure gets better. I mean, obviously, the arthritic stuff, the muscular stuff, people with fibromyalgia get it better. Nerve pain is difficult, chronic neuropathies. I haven't looked in the last couple years on any newer studies, but most likely it's more difficult for resveratrol to get into the central nervous system. So your brain and nerve endings, they have a harder time. But I see people do get better. It takes longer. I'm seeing 4 to 6 months before they get results. And so any condition that has a significant chronic inflammatory component will get better. So for now, that's kind of the overview and how it works. I'll get into some dosing protocol right when we come back after the break. Hi everyone, it's the cold and flu season again, and this year's pretty nasty. Well, do you know what the best cold and flu remedy is? Well, it's a remedy that would be natural, strong, kills viruses, and has some science to show that it really works. Well, that's KSK Cold Spray. KSK Cold Spray is an all-natural, germicidal spray that eliminates cold and flu symptoms in 24 to 48 hours. I proved it in a study of 200 patients, and now we've probably had 700 people that have used the spray. Every year it's curing hundreds of my patients. So don't be miserable anymore. Go to kskcold.com, that's kskcold.com, and you'll love what you read. I'm Dr. Debunk, the medical truth teller. Welcome back. So I'm going to get into some dosing stuff on how to use it. But I forgot to mention, Patients have told me some interesting things that I haven't really quantified, but people over 55, 60 tell me their night vision gets better. The eyes, actually optometrists, have used antioxidants longer than anybody, and I think they started using resveratrol before all this, thinking the antioxidant power would help. But anyway, the eyes, because of the light exposure, have a greater degree of inflammation, so it's helpful there. Memory gets better. For many people, they'll say they have better short-term memory. And finally, the big C word, cancer. There is no studies that I've found on this, but because we have laboratory studies showing the absolute cancer-killing effect of resveratrol, it doesn't take a genius to say that it's beneficial to use it. I mean, and so that's what I say to people now. If there was a nutrient that you wanted to take to try to help prevent cancer, resveratrol's it. Because of the science that has been done, but how to actually use it. There's no way you're going to take enough resveratrol orally to cure yourself of cancer. So don't even hear me say, imply that at all. We have studies on how much you can take, and I'll get to that in a minute. I've never had anybody be able to take like 2,500 milligrams a day and not get just terrible diarrhea. So you can't take enough to treat it. Now, IV resveratrol, which is coming, something I'm going to start doing for patients, could be a cancer adjunct. In other words, just like vitamin C can be given IV in high enough doses to kill cancer cells, which it does, resveratrol will also be able to do that. And so that's coming along. So these are aids to treating cancer. But as far as preventative, it's another tool, I think, like many things. Like, good sleep. You could build the case it can prevent cancer a little bit. Hard exercise is the number one thing probably to prevent cancer. Anyway, so that's about it. So let's talk about blood testing. I've talked a lot about chronic inflammation. Well, the nice thing about it, there's nothing nice about it, but we have 30 different blood tests for inflammation, markers in the blood that show up that give us an idea about specific kinds of inflammation. And I won't get into all that. You can get more out of the book. But basically, there's a couple tests now that we've been using in the last 10 years, more and more, called homocysteine and CRP. CRP stands for C-reactive protein. And homocysteine and CRP are molecules or substances that are generated in the presence of inflammation, both acute and chronic, it doesn't matter. And so if you have acute or chronic inflammation at different levels, these markers go up. Now, we know a lot more about CRP than we do homocysteine. Homocysteine seems to be related to vascular inflammation, which will be very beneficial down the road if we understand it better. Now, I haven't looked at this one also in a couple of years, so hopefully there's been some more studies on it. But CRP has been around a long time. And so how you look at these is every source of inflammation every day, every week, every month, every year contributes to CRP, and it leaks into the bloodstream. So if you're 50 years old and still drinking like a fish, your liver is massively inflamed. It stays inflamed until it gets near cirrhosis, which is where it's dying, and then once it dies, you die. But before that, you're getting alcohol-induced hepatitis. I mean, we think of hepatitis as being the virus, but chemicals and drugs cause hepatitis. Alcohol is a drug. Well, the inflammation is going to be massive, and so that's going to leak into the blood, and we can measure it. So when we see elevated CRP above normal, we know there's sites of inflammation. Now, you can't tell whether it's acute or chronic. So how we use it for this is if you're not having any acute situations right now, you didn't smash your ankles, you're not doing any weird lifestyle stuff, booze, drugs in excess, your life is just flowing along naturally, you're not infected, you have a certain baseline level of CRP. Now, CRP under 25 is almost non-existent. In fact, you don't even measure it in young people. And then in the 40s, you start to see it go up. And so if 0 is less than 1 is what young people are, if you're 80 years old and crippled with arthritis and you're in chronic pain and you're on morphine and you wish somebody would put you out of your misery, your CRP could be 100. And when your CRP is 100, you wish you were dead because it hurts. Now, not always. CRP is, and this is just my opinion, about 2/3 accurate. About 65% of the time, it correlates with what you're feeling in your body. And so we can use this as an objective measure, CRP and homocysteine, to get an idea of where you are with inflammation, chronic inflammation. Because if you don't have any acute things going on right now, that number, if it's elevated at 5 or 6 or 7, that's too high. That means chronic. That means there's a chronic source. And usually, always almost, if it's in your muscles, ligaments, bones, joints, you know it because we have so many nerve endings to those parts of our body. But if it's internal, heart, lungs, pancreas, liver, it's more difficult because we don't feel those things. We're not aware of it. Women are more than men. And so it makes treating it much more objective. And now that I've done it for 5 years, I have a lot of background with 600-700 patients doing this. I've seen thousands of CRP and homocysteine results. And so basically the goal is to get CRP and homocysteine down to, for lack of a better age, 30-year-old levels. Now, why do I pick 30-year-olds? Because we see 80-year-old people that have CRPs of 1 or less. Well, that's what 30 years old and less have. Now, until we started doing this, we would have never thought that. But in fact, optimally healthy people, there's that word again, optimal health, have low CRPs and homocysteines. And in homocysteine, I won't talk about much because I really need to review it, but we really have a harder time correlating what you're feeling with homocysteine. I see elevated homocysteines and people feel nothing. I see relatively normal ones, and these people are having significant inflammatory symptoms. But there's a growing understanding, at least the last time I looked, with vascular issues, heart and blood vessels of the body. So what we have then is a way to analyze treatment outcomes, and that's how these tests are used. Okay, treatment, how does that work? Let's get into that. Well, we're using nutrients in general more and more like drugs. In other words, physicians like me realize that if you want to get more initial or immediate effects, more rapid effects from nutrients, then you have to use them kind of like the way we use drugs, drug therapy protocols. And the simplest way to talk about that is loading dose therapies. Numerous drugs to work, you have to give a lot in the beginning. Then once you're saturated in your blood and your tissues, you don't have to give as much. Well, that is really true with nutrients. It's a long story why, but if we talked about, say, vitamin C, which is one of the most common vitamins given over the last 50 years in different amounts, I mean, you can go on YouTube and find thousands of videos on magic vitamin C. It'll make your hair grow. It'll make whatever you want grow. You can probably, what do you want it to do? It's magic. But what we see, based on blood studies, that taking 1,000 milligrams of vitamin C every day is not as beneficial as if you took 1,000 milligrams every hour for 7 hours, or 500 milligrams every half an hour. In other words, it's the same weekly amount, but you'll get a higher blood level, and it'll affect your health better if you do a loading high-dose protocol. Now, that's another discussion, and I will get into that at a podcast about how to take vitamins and minerals, because we have enough information now to make a pretty strong statement about how to do it correctly for those of you that want to supplement. So that's what we do with resveratrol. You're going to take a lot for the first 2 or 3 months. Well, not a lot, but a regular daily dose, and then you're going to back down. And so how that works is, and I'll summarize it at the end, you have to take it twice a day. The reason you have to take it twice a day is it won't work if you take it once a day. If you only take resveratrol once a day, it washes out of your body over 24 hours. 95% of it is gone. So that means the next day there's only 5% left. If you take it twice a day, you'll have about 30% left. And so every day you're building. After day 1, you have 30%, then 60%, 90%. So by the 4th day, you get twice as high a blood level. And it takes 14 days to get to what we call peak plasma level, and I won't explain that. But basically, it doesn't do anything for 14 days. And then, over the next couple of weeks, by having it at a high enough level in your blood so it'll get into the cells of your body where you need to block the inflammatory upcycling of the nasty little interleukin, the little inflammatory mediators, it's blocking them. And that's why it takes a month for people to feel anything. It will take a month for you to feel anything when you do resveratrol therapy. So don't say, well, I tried it for 2 weeks and it didn't work. It took 2 weeks just to get it going. So, and then over the next 1 or 2 months, so by month 3, I see now after 5 years, most people have the maximum benefit. After 3 months, and that's if it's a non-central nervous system problem, it's not going to get you any better. It'll lower your blood pressure a little bit. It could help your aches and pains more than anything. Allergies are affected, definitely can help allergies. And so that's pretty much how you do it. Now, the amount you take is, you have to start out at a minimum of 250 milligrams twice a day. Now, in the next podcast, I'm going to get into the types of resveratrol and how that works and how to look out for the junk resveratrol, because there's tons of resveratrol out there. In 2012, and I'll talk about this, there was a medical study that was done on smokers, and they used the highest dose to that time, 500 milligrams of resveratrol, and it reduced these smokers' CRPs by 50% in a month, which is dramatic. All I can tell you is that is a dramatic finding. And so after that, all the supplement companies went gaga and started making higher doses, and everybody wanted to get in on it because now we had a doctor study showing, you can take a lot more than we used to give. And of course, they just saw the dollar signs. But in this case, it isn't a bad thing. I'll get into all that. But for now, the average woman has to take 500 milligrams twice a day for the 2 to 3 months to get maximum benefit. Men need to take 1250 to 1500 a day. Now, here's the problem. It's a laxative. And with age, it's a potent laxative for some people. It's probably 10-15% of people, they just can't take resveratrol. It really stinks. But 1 a day, 250 gives them diarrhea. And I've had some patients try really hard and they just couldn't take it. But almost everybody can take 2 a day, 250 in the morning and 250 milligram at dinner. You take it with food. And if that's all you can take, it'll take longer. It'll take 4 to 6 months to get peak effect, but it will work. For women, if you can do 500 twice a day, you'll be happy little camper in 2 months. Men, I like to do 5 250s or 6. And then how it goes, after you've done it for 2 to 3 or 4 months, then you go to a maintenance protocol. You don't have to take it every day. Because think about what we've done. Your inflammatory markers will just say, let's say your CRP was 10. Well, we want it to be 1 or less, or say 1 to 2. So every month you take it, you're going to drive that number down. And like I said, I've done hundreds and hundreds of studies, and you'll see this over and over again. And so you will, in a month, take that 10 and make it go to 5. And the next month, it'll go to 2.5. And then the next month, it'll go down to 1. Now, that's an ideal scenario. Some people take longer, but that's about the fastest it'll come down. And at the same time, your symptoms come down. In this case, the most commonly used, the most common reason we're using CRP is for the aches and pains of aging. And so you bring it down. Well, now that your inflammation level is lower, more normal, and I'm not going to get into how it works. What it actually does to the interleukins is still theoretical. We think it blocks the receptors. Anyway, now that it's down low, you don't need to take it every day. And so there's 2 ways you can take it long term. Some people just choose to take 2 a day, 1 in the morning, 1 at night, every day forever, which seems to work. I like the high dose therapies. So what I do, and I have a lot of patients doing it, I take 6 a day, 4 days a week, or 4 days or 4 days every 10 days. I'm trying to stretch it out again. Because what happens is, look, let's say you take it, like if you're under 50 or 55, depending on how much you beat up your body, if you bring your inflammatory levels down to a normal or optimal range, and you're off resveratrol for 7 to 10 days, well, it only climbs back up a little bit. Remember, it's been elevating. By the time you hit 45, you've had 10 years of a slow elevation. When you get it down to optimal levels, it can only rise a small amount over 7 to 10 days. So you go back on it for 3 days, and then you drive your inflammatory levels back down to optimal again. And so that's the variability. If you don't take it enough, your aches and pains will come back, which is a time for me to say something very important. Resveratrol doesn't cure anything. We don't know why our body goes haywire with inflammation. Why can't we get rid of acute inflammation so that we don't have any chronic inflammation? That's the million-dollar question, folks. That's probably going to take another 20 years to understand. All it's doing is interrupting the cycling. If you stop taking resveratrol, the inflammatory modulators are going to come back and make everything hurt again. And I've done this numerous times in the last 5 years. I get temporary brain damage and I forget to take it. And by about the 3rd week, I'm like, what's wrong with me? Everything hurts and I don't feel right. And then I realize, oh my gosh, it's been 3 weeks and I haven't taken any, 4 weeks. And so I go back on it and try to drive out the crazy Martians that invaded my brain and made me did stupid stuff. And so it's a lifetime thing that you'll do. And the idea is to take the least amount of resveratrol to get the optimal health effect. So that's about it for today. Just as a quick summary, because this is mostly about how to take it. Resveratrol has gobs of science to prove that it works. I think, the biggest kind of loose study going in the United States. Like I said, I have 700 patients, 700 patients easily doing it, and everybody learns not to stop. And I keep data in their charts. Someday I'm going to have it all tabulated. And so it won't be an official study, double-blind placebo crossover, which would be the best. There's some small ones like that. But there's no question of how it works and what it does. And so you take a loading dose at first where you take it every day faithfully. You have to be faithful. If you take it once a day, it's not going to work. Don't come crying to me like patients do when I question them because they say, it doesn't work, doc. And when I find out, well, yeah, I'm missing days. I only take it 4 days a week. Sometimes I only take it once a day. Well, then it doesn't work. If you don't put gas in your car, it finally runs out. And so then you yell at your car, why aren't you working, car? So you've got to follow this or it's not going to work. We're essentially using a safe, natural substance the same way we doctors use drugs. But there's no downside that like the downside of drugs, the side effects. And so anyway, after 3 months, you have the reasonable certainty, you can do the blood test, which is great, that you are receiving maximum benefit, and then you go down to the minimum amount necessary to keep away your symptoms. And so that's usually 3 to 4 days a week, every week or every 2 weeks. And then some people, I have a lot of women that just take 2 a day forever, and usually about 5 days a week. They a lot of times miss the weekends. But it's working. And so I have 5 years worth of patients, and I'll just keep keeping track for as long as I keep doing this. And so thanks for listening. The next podcast, we'll talk about which resveratrol to get and why, and some of the other important issues. I'll talk about a little bit about young people, athletes, because if you're a young athlete and you want to recover quickly from your marathon or whatever racing stuff you do, of course you want to recover quickly. Your new best friend is resveratrol, because you will be blown away how it works. Marathoners, other people, even young people have an excessive inflammatory response of an extreme activity or behaviors, and you can use it. It's really not indicated for people under 40, 45 years old, except for short-term use to modulate an extreme inflammatory response. And so that's it. Thanks for listening. I'm Dr. Debunk, debunking medical myths, garbage, and crap spread by doctors and other health professionals.